RPA is classified PG. It contains medical procedures. The Nine Network recommends parental guidance for young viewers.
You've been trying for
Tonight on RPA.
Haven't had any luck getting a brother or a sister, eh?
Ruby wants to have another child, and the odds are stacked against her.
We clearly can't do anything about your age and the eggs, so really the only thing is to deal with the endometriosis.
Truckee Bill's in pretty bad shape,
I'd be lucky to make it up the hill.
and he's got smoking to thank for it.
For a 59-year-old?
55.
55? That's not too good, is it?
No, it's not.
No.
Is my toe going to be fine, or am I going to lose it?
Has dipping his toe in proved too costly for swimming pool builder Max?
I was in shock. I had pins and needles through my whole body.
And remember Gemma?
You're the sort of second person in Australia that has had this procedure done.
I'm lucky I've got this option.
Her husband Stephen is giving her part of his liver to try and save her life.
We'll see you on the other side of it all.
Now their daughters have to say goodbye to Mum and Dad,
Good luck.
Yep.
Okay.
See ya.
Love you, Dad.
not knowing what the outcome will be.
We wouldn't be responsible if we left you guys orphans.
Hello. How is everybody?
Hello.
Hello.
How you going?
I'm good.
You good?
Yep, I am.
Cool. Good.
What's going on? Big dog. How are you?
How you going, man?
Good, sweetheart. I had a good sleep.
Did you?
So where are you off to now? You going
Downstairs.
Downstairs?
Yep.
So you're right?
Yep.
It's the Medicare card and yourself.
Right.
And your liver.
Prime liver.
Prime liver. That's exactly right. Okay. Bye-bye, sweetheart.
We'll see you on the other side of it all.
Hope everything goes okay.
All right.
You going to come back up to me later?
Yeah.
Mm-hmm.
See ya.
See ya. Everything will be fine. Love you.
Love you.
Hello, Rommel. Michael Cooper.
Hi, this
Ruby,
is
how are
Ruby.
you?
How are you?
Very well. Nice to meet you. Please have a seat.
Thank you.
Hello, what's your name? Enoch. Hello. So, Enoch, you're 6?
Yes.
Okay. So, Ruby, you're 34 now?
Yeah,
And you work in the hospital here, yeah?
I'm working here at RPA,
Okay.
yeah.
And the problem is you've been trying for a while, but you
Yeah, it's been...
haven't had any luck getting a brother or a sister, eh?
Yeah.
You must have said that when you had when you have your periods, you get some pain sometimes.
Yeah, I do get terrible pain even week or 2 weeks before.
Okay. So probably what's happening, because you've been pregnant before, we can pretty much presume that, look, the sperm's normal, most of the other anatomy and things are okay, and the blood tests that you've had have ruled out thyroid problems and all of the common sort of things.
Yeah.
But the most common thing that's probably left is a thing called endometriosis. Endometriosis is where the lining on the inside of the uterus that you would shed once a month, for whatever reason that we can't explain, grows outside of the uterus. And that's sort of toxic.
Yeah.
So it's painful, and it also causes problems getting pregnant.
Okay, Stephen, so the game plan today is that Dr. Sandrusi and I are going to start with your operation. I'm going to be there for all the crucial parts of your operation, but I'm not going to be there the whole lot because I'm going to be going into your wife's operation later on as well. This all should be very straightforward. We think it's a very brave thing you're doing, however, to put yourself in harm's way for somebody you love so much. And I guess you're only doing that because we just don't have enough livers, unfortunately, donated through the deceased donor program to get your wife a liver in a timely fashion. So, best of luck. We'll see you when we're done.
When a couple starts to try to get pregnant, most people will be pregnant within about 10 to 12 months, something like that. And once you fall off that curve, as time goes on, the likelihood is that you won't succeed, and your chance actually gets less and less. And it's probable that you've got a combination of two things going on. One is that you've quite possibly got endometriosis, and the second thing is that as you get older, and particularly as you approach 35, your chance of getting pregnant naturally just starts to drop away. And so those two combined things have created the issue. So we're at the point now where, is there anything that we can do to improve your chances and see if we can get you pregnant again? We clearly can't do anything about you know, your age and the eggs. So really the only thing that we've got that we can change in your favour is to deal with the endometriosis.
So what we're going to do this morning is get in and have a look around, make sure that there's no reason that we can't proceed. Our first priority is going to be to make sure that we get Stephen through this as safely as possible, and we won't take any undue risks to his life in doing this. But we also got to consider that Gemma needs a good piece of liver. So if we don't think that we can provide her with a good piece of liver for any anatomical or pathological reason, we won't proceed.
So here the liver's been mobilised from all of its attachments, and you can see it's a very nice, healthy organ. There's no fat or fibrosis or any problems with the liver.
Our line of resection is going to be from up here near the heart in a line that runs basically through the gallbladder there. The right half is going to go from him to Gemma, and he's going to be left alive with the left half, which is much thinner and longer. So if we could just let the team in the other theatre know that we'll be able to go ahead, and everything's going very well, and we're happy with things so far here. So they'll be able to call for the patient now, and we should get Gemma coming down.
Another way to work out if that's what it is would be to do a small operation, a thing called a laparoscopy. So basically keyhole surgery. Put a little telescope through the belly button, and we have a good look around, see what's happening. And then at that point, if we can find the area that's the endometriosis, then we try and remove it. So we will try and chop it all out. It really depends what we actually find in terms of what might happen in relation to getting pregnant. It's not that surprising, but to a certain extent, the more severe the disease, the bigger the impact in terms of getting pregnant. So paradoxically, it would be better for you if we find a lot of endometriosis. Because if we find a lot of endometriosis and we remove it, you'll have a dramatic improvement in your pregnancy prospects. And that might be all you need.
We really wanted to have one more kid, and just give Enoch a baby brother or baby sister. That would be great, and you know, it's going to be complete our family. Yeah.
Excellent. Well, let's hope we can help.
Yeah.
Hi, Gemma.
How you going?
How are you?
I'm good.
All set?
Yeah.
Well, everything's going all right in the donor procedure.
Oh, fabulous.
So we've had the news, and so we can go ahead.
Yeah,
all
terrific.
Right. So we've discussed all this yesterday.
Yes.
And these are your daughters?
Yep.
All right, well, we'll take care of you.
Yep. See, you'll take care of me.
All right. And we'll come and talk to you afterwards, okay? So she's going to be in there for many, many hours.
Yep.
Because the liver from your dad won't be available for a couple of hours yet.
Oh, yeah.
But we're going to go around and get things started with you.
Okay then, terrific.
Any last questions?
No.
Okay.
Let's get going.
All right.
Okay.
We'll see you there.
Okay, thank you. Okay, see ya. See you, Mom. Love you. Good girl. Love you. See ya. See ya, hon. Love you too.
Specimen coming out, piece coming out, whatever. So we're running fluid through the inflow veins, and we can see it flushing the blood out here, and it's gradually becoming clearer and clearer. We want to flush that till all of the blood's out of the liver, and we're also going to flush the artery. So this is a special preservation solution that's designed to keep the liver from deteriorating over many hours, as long as it's kept at a 4-degree temperature. We're just putting the liver now in some bags, and now we've got to put it in a bucket. This is just something that allows us to transport it. It's designed for transporting across great distances rather than a few metres down the corridor. OK, let's put this in an esky, please, Nick. Yep. Thanks very much. OK, try a minute. We'll go take this around the other side.
Hey, how are you?
Good, thanks.
My name's Kai, one of the doctors down here at the emergency. What's brought you in to see us?
I've cut my foot with a circular saw at work.
Okay. Were you wearing a boot at the time?
Yeah, I was. It just went straight behind the steel cap.
Okay.
So just behind there.
All right.
Yeah.
And what do you do for work?
I build swimming pools.
Swimming pools?
Yeah.
Okay. That's interesting.
Yeah.
Hard work?
Yeah, it is pretty hard.
That's fine. Do you mind if I have a look at this?
No, you're all right.
Are you able to move your toe at all? Up and down? Good. Can you feel me touch you there?
Yeah.
Yeah? How about that side?
Yeah.
What we need is to get the orthopaedic doctors to come and see you.
Yeah.
Okay. And most likely you need to go to the operating theatre, okay, to get that washed out and also to get that fixed up.
Yeah.
Because essentially it's gone straight through the tendon.
Yeah.
And possibly also through to the bone.
Is my toe going to be fine, or am I going to lose it?
Hopefully it'll be fine.
Yeah.
Okay. They should be able to repair it. At the moment, it's still got nice blood supply to the top of it.
Yeah.
It seems like the sensation is still okay. So I think you'll still be able to keep that toe.
Right.
All right.
Did you say I went through the bone or just to the bone?
It sounds like it's gone through half of the bone.
Oh,
okay.
Yeah.
So we'll get some x-rays done.
Yeah.
Okay. And we'll come back and we'll have to talk to you about it.
All right,
So we'll
no
see
worries.
how deep it's gone.
Okay.
Okay.
Thanks for that.
Hello.
Hello,
How you going?
going?
Nice to see you.
Amber.
My name's Charbel. How you
Nice
going?
to meet you.
How you going? I'm one of the liver transplant surgeons.
Yep.
I've just finished doing an operation on your dad, Stephen.
Yep.
Everything's gone well.
Okay then.
The right half of his liver was a very good size. It looked very healthy.
That's what we want to hear.
There was no problems with the surgery. He didn't lose too much blood. He didn't require a blood transfusion or anything like that.
Oh, good. Yep.
And he's been very stable throughout the whole operation.
It's really good to hear.
He'll be awake in a few minutes and around in recovery.
Okay.
You won't be able to see him until he's in ICU, which is about half an hour to 1 hour's time.
Yep.
Okay? We've got to keep a very close eye on him over the next 24 or 48 hours.
Yep.
Make sure that his liver's working okay. The other guys are in there just finishing off your mum's operation.
Oh, wow.
So hopefully the liver will have some blood going through it pretty soon.
We're not over the line yet.
No, you're not. That's right.
Yeah.
Okay.
No, that's good. Thank you.
Good.
That's good news.
That's all right. My
so
pleasure.
far. Yay.
Hey, Max. So we got the x-rays back.
Yeah.
Let's bring around to show you. So that's your big toe there.
Yeah.
And that outline there is the outline of the toe. And you can see that gap through there.
Yeah.
And what's happened is basically the circulus was essentially gone through that bone.
Yeah.
And there's a bit of gas under there where the skin's probably broken through as well. And so the circulus sore's probably gone through your skin, through your tendons, and down into the bone as well. Okay? So the most important thing we need to do there is just to give that a good clean, wash it out, okay?
Yeah.
And make sure there's no bugs or any dirt like that getting in there to infect the bone. The next thing is the orthopaedic doctors will come and see you.
Yeah.
And what they'll do is take you to the operating theatre and they'll just wash out, give a good clean of the toe, fix the bone if they can, and fix the tendons and close up the wound.
Yeah.
Yeah.
Okay, so the liver's coming out. So this is the old diseased liver. It's cold saline. Yep. So we normally don't put cold saline all over this. It normally goes off to pathology, but we might be using some of the vessels within it to help reconstruct the other piece of liver. And this is the big empty space that we're left with. So this is all the area where the liver used to live, and these are the big veins where the majority of the liver's blood drained into this vena cava, which is now completely collapsed. But when it's all blown up, it's like a garden hose, and this clamp is protecting the patient from bleeding out through there. So this is the explanted liver from Gemma, and we're looking at the underneath of the liver here, really, the bit that you don't really see normally. And the important thing we need to do here is to mobilise this vein that I'm holding, which is the portal vein. We need to take that up a fair way into the liver, and that's what we're going to do now. Gemma's fortunate that there's no actual cancer in her liver, because sometimes we do a liver transplant for cancer, but not in Gemma's case. So we can take these vessels and use them to reconstruct into the liver that's over there from Stephen.
No. Jeez, you brought a full bag.
How are you feeling? You okay?
Yeah.
Yeah.
So obviously it's this foot.
Yeah. Just the big toe.
They should be able to reattach it.
Yeah, they said there's more than likely they'll be able to.
Straight through your boot?
It went just behind the steel cap. So it's pretty unlucky, but I just saw them with the circular saw, and like when you're going through something, they hit knots in the timber, and it like kicks the saw back if it's a big knot, and just kicked back and went straight over my foot.
So you're in a lot of pain. You sounded like it when you rang me.
I was, yeah. It was killing.
Hectic.
I was in shock. I had pins and needles through my whole body. Mudgy like lifted me out of the pool, and I pulled my boot off straight away. And then I took my sock off and I saw it, and then I go have a look, Marge, and he had a look. He's like, dude, you got to go to the hospital. It's pretty bad. So then I tied my sock around my toe, just tightened it as tight as I could, and then got in the car, came here.
Bit dramatic for a day off, eh?
Yeah. Hopefully everything's fine.
How you feeling?
Like shit.
Like shit? I bet you feel like you've been under there for a minute. Yeah. Oh, well, we've been just sitting around waiting for you to come out. We're excited that you were out and everything went well.
It's all right.
She seems to be going well, yes. Yep, everything's going to plan with Mum, and when I spoke to the surgeon last, they were just fiddling around with the liver and filling it with, aiming to fill it with blood and things like that, so, yeah. You're not in pain or anything?
No, not really.
Not really? That's good. Mum will be happy with you then. You're a bit dopey, Dad. bit quiet, isn't he?
Okay, liver's out of ice.
Excellent. So what we're doing now is we're just sewing the right hepatic vein from the new piece of liver onto her inferior vena cava at the point where her right hepatic vein came out. So it's a large gaping hole. It's got to take all of the blood flow that runs through the liver, which is all the blood that comes back from the guts and stuff like that. And we're just about finished closing that. Then we've got to flush the liver through because the preservation solution that we've used is toxic to the heart, so we don't actually want the preservation solution to be in the liver after this.
Okay, so that's flushing through quite nicely.
And then we'll just promptly join up the portal vein. This is exactly the portal vein joining back up to its old buddy because David cut her portal vein, and then we used that on the back table to reconstruct the two veins from Stephen.
So this is the liver that's now put in, and if you look at it, you can see it pulsing, which is really fantastic. So the liver's now going to get a lot better. So the transplant's finished, and the liver actually looks fantastic now. It's really nice and pink and very soft. And here's the cut surface. So the other half of the liver is still in Stephen. We can feel the artery, and it's very good. So we're right now going to put some drains in and close the wound. So we're done. It's gone really well. We're very happy.
My name's Andrea. I'm one of the nurses here. Just need to check some details before we take you through. And what are we doing for you today?
Hysteroscopy, laparoscopy, and removal of endometriosis.
Signed and dated,
that's my signature,
you?
yeah.
I'll just say bottom up.
Bye-bye. Okay. Bye-bye. You behave, okay?
Yep. Okay, Ruby, Sam will take you through to theatre 8.
Hi,
Sam. Expecting you now. There you go. Bye, Mommy.
Bye-bye. Good luck.
So we're just looking inside her uterine cavity now. That little hole that we're looking at just to the left of the screen is her right tubal ostia. So the sperm will go up through there and the eggs will go up through there, and then fertilisation actually occurs in the fallopian tube, not within the uterine cavity. Most people think it's in the uterine cavity, but the egg will be fertilised within the fallopian tube and it'll stay within the tube for about 5 to 10 days. And then the fertilised embryo will come down and then implant within the cavity. And we can see here her cavity is pristinely normal, and we don't need to do anything there. So let's just take that out. Now what we'll do is we're going to do a laparoscopy, so it's sort of keyhole surgery.
G'day, mate. How are you? Good, and yourself?
Great.
G'day, come on and sit down. Have a seat. With the headbutt. Alrighty. Do you want to tell me about what brought you to come and see me?
Been having troubles with me left leg. Having trouble walking. Pains in my leg, pins and needles in my toes, coldness.
Was it a gradual thing or just sudden?
Sort of a gradual thing. I thought I pulled a muscle because I was mowing the lawns. And it'd come and go to start off with. And then just gradually it got worse.
What were the symptoms and things that you noticed? Which parts of your leg did it?
Started with I'd get pains in my calf muscle. Right, and then gradually, like if I kept walking, the pain would go up my leg, and then I start getting pins and needles.
What sort of distances can you walk now?
I'd be lucky to be able to walk 10, 20 metres.
And for a 59-year-old?
55.
55? That's not too good, is it?
No, it's not.
No.
So what we've done is we've put in a telescope here with a little camera attached. So this is the uterus, this big ball of muscle here. And then on the right here we've got a fallopian tube. That's the very end of the tube, and that's the bit that fans out and picks up the egg. And then inside the tubes there's where fertilisation occurs. This is her ovary on the right, and it looks as though she's probably been, well, she just ovulated from this side. And here's the tube and the ovary on the left. And the most common place to get endometriosis is down in here, and there's really nothing there, although that's probably endometriosis just there. It's fairly mild, but that area just there and this area just here. There's a slight white sort of appearance to it and a little bit of discoloration.
So, just to recap what's going on, the artery into the abdomen going down your left leg is blocked just through here, which is the external iliac artery, and it's limiting blood supply down your left leg, which is this vessel coming through here. Your disease in your arteries is not just limited to this segment. It is going to be in your neck vessels. You are going to have some degree of some disease in your heart, but nothing significant as yet. And this disease, I'm sure, is going to actually extend down into your leg. What I want to do before we proceed on with any intervention, I want to get some good pictures of your legs, and that's with an angiogram. Yep. The pictures will show me the inflow, and then all these little vessels will connect up here, and you'll get some blood coming down below the leg. And I need to see where those blood vessels rejoin the good big ones.
Yep.
Then what I'll do is make a cut in the artery into the blockage, and also making a cut down below the groin area, and I will be cleaning out that vessel, cleaning out all of that plaque, so that we can create a normal channel again and blood can get through there. That's what I think is going to happen at this stage. All depends upon the angiogram, so we'll get that done, and I'll be talking to you about it after that, and then we'll go ahead and we'll plan your surgery.
So this area here, you can see it's fairly subtle, but that's the endometriosis. Well, that's the area that I think is going to be the endometriosis. And now we're going to use basically heat, and we just want to remove this sort of area here. And we know from studies that have been done for quite some time now that if it transpires that the histology confirms this as being endometriosis, then that will improve her pregnancy prospects. And what we've done is we've used a technique where we've sort of cut around all of the endometriosis so that we think about it a bit like an iceberg. So we like to get under all the disease and remove it all. We don't want to leave any areas behind. And we've taken a piece of tissue out that's probably a bit bigger than a 50-cent piece. So we're now fine here. We'll just have another little look at this here at the back, make sure it's not bleeding. That all looks good. So if that is endometriosis and if that's confirmed, we'll improve her pregnancy prospects.
Now, we've got two sides of a coin. We've got the risks for the procedure and we've got the benefits. Now, the risks for you, if we don't do something, is that you've got risk of ongoing problems with tissue loss, which is ulcers. You could lose toes. Your leg will not get any better, and if you get some ulcers, they're very, very difficult to heal until we get more blood down there. The benefits for you are really significant. and they outweigh the risks substantially, because you'll get your leg back, it'll be warm, you'll be able to walk, you'll be able to do the activities that you want after you recover. A little bit of background, do you smoke at all?
Yes. Smoke about, a packet of 20s will last me about 2 days. So it's roughly about 10 a day.
We know that smoking and arterial disease are really, really related. And with the blockages, now that you're heading down the track to have something done, we've got to seriously consider about doing something about your smoking and getting you on some sort of program to get you off it. Because if we don't, it's only going to come back, and it can come back worse than what you got now.
Max, how are you?
Good, thanks.
So I just wanted to talk about the surgery. So it all went well. You'd done a pretty good job of this. So you pretty much sliced through the top half of your big toe. So it had gone through the tendon, and it had actually gone all the way through the bone. Before the operation, we weren't sure how much of the bone was damaged, but when we opened it up, you'd actually sliced all the way through the bone. You're actually pretty lucky to have the toe, considering how much damage you'd done. The problem was when we did the operation, we actually found sort of fragments of dirt, and the dirt was actually embedded within the bone. So the safest thing to do was we actually cleaned it out, but we didn't want to have to put any plates and screws in at this point in time because there is a risk of infection. So it does mean we'll have to take you back again, and probably in 2 days' time we're going to do another clean out. By that stage, we're hoping that it would be even cleaner, at which stage we can actually go ahead and reconstruct everything. But reassuringly, I think we are going to get most things back together.
She looks a bit different. She's got a liver in her butt, that's for sure. So she's going to feel different when she wakes up too.
So look, it's all gone really well. I think we can all be really happy with the way the surgery went. It's a bit daunting when you see your mum like this, okay?
Yeah,
but this is pretty normal.
Yep.
I did warn you that she's a bit more swollen in the face and things. That's fluid, and there's a lot of fluid shifts that happen. We're going to keep her asleep overnight at least, but I would think that the tube will come out for her breathing tomorrow.
Okay then. So that's what it's for, breathing.
It's for her breathing, to keep her lungs inflated and so she doesn't have to do any work. Her bloods so far look pretty good.
Yep.
Okay, so big thumbs up.
Oh, very good.
We're
That's what we
expecting
wanna
her
hear.
to do really well.
Yes, I think she will.
Yeah, it's gone well. It really has. Big thumbs up.
I'll see at the other end.
Yeah, hopefully it'll be the last one, and
yeah, hopefully they close it all up today.
And your mum will be here a bit later this afternoon.
No
Fingers crossed, eh?
Yeah. Thanks for that.
All right.
See ya.
Yep.
So we're just cleaning out the blood clot that's in there now. So the last operation, we just cleaned it all out and took out all the debris that we could see. And so actually the tissues look nice and clean now, which is very reassuring. And so now it's ready for us to do the reconstruction. This is the tendon for the big toe that he's cut. It's been cut all the way through, just through here. Knife fix. And this is the tendon that's responsible for pulling the big toe up. So this is one that we need to repair. So we'll come back to that. Now we're going to need a plate shortly, thanks. So what I want to try and do is put the plate away from the tendon, so we don't want the tendon rubbing straight over the top of the plate, because that's obviously going to predispose it to actually tearing again. So we're going to put the plate on the side. And so what we're going to do is actually, once we reduce the bone, we're just going to put the plate on the side here and put some plates and screws in to hold it together. So let's slide this plate up.
Hi, Stephen. How
you
are
going?
you? Day after.
Yeah.
How you feeling?
I was really good this morning, and then they sat me up, and I got really lightheaded.
Yeah, probably a bit dehydrated after a big operation yesterday. So I just wanted to recap for you on what happened yesterday and how it's all gone.
Yep.
it's essentially gone according to plan. So
Very good.
your operation took a long time, several hours, and finished yesterday afternoon sometime. Gemma's operation continued into the evening, and we finished many hours after starting her operation. What we were delighted with, though, was that we were able to get your piece of liver out, flush it out, and then get it implanted back in her and the blood running into it very quickly.
Yep.
So everything on her side looks great. She's awake, they've taken the tube out, and she's going great. I'm just going to wander around and see her shortly. We're all really happy, and I'm really proud of the whole team effort. It was a big team effort yesterday.
Everyone's been great.
Do you guys have any questions?
No, we're just...
Quite scary to see both your parents operated on at once?
It is quite scary to see both parents, but, you know, you do these things for the ones you love. So we're pretty excited that Dad was actually able to do something like that a lot of other people wouldn't be able to do. He is a hero.
He really is a hero.
Yep, aren't you, Dad?
He doesn't think that, but
No.
we all do.
We've just put the plate on the side of the bone there, and we've got the bones opposed nicely, so there's no gap between the bones now. So let's get some final x-rays now. X-ray, please. So this is the x-ray of what we've just done. So you can see the plate on the outside, with the screws going across on the near side of the fracture, so 2 screws on the far side. We actually see we've actually just shortened that segment of bone up, so there's 2 good bone surfaces touching now. This is the tendon where he's cut through now, and you can see there's one part of the tendon there and there's the other part. We need to join those 2 together. By shortening the bone, it's actually been quite easy to get these 2 together now. What we're going to do is just put the sutures into the tendon now. You can see now, just pulling on the tendon, we've got a nice good bite in that tendon. And it's actually, tendon's got a bit of give there as well, which is good. So we've got one end of the tendon sutured in, and we've got the other end of the tendon. Now we've just got to bring these 2 ends together now. You can see here, those 2 tendons should come back together quite nicely now. So these are additional sutures that we're putting in just to add to the repair strength. And you can see when we move the toe up and down now, the tendon's actually holding on without too much of a gap, so it actually looks pretty good. So what we really need to do is just wash it up and close it up. And so we can push the toe all the way down, and the tendon's holding on. So, which means we can probably get him going a little bit quicker than if we hadn't got a decent repair on this. So that's quite pleasing.
Hello. I'm good. How are you? More's important.
Not bad.
Feeling better without a tube in your mouth, I imagine?
Oh, God, yeah.
All right.
Yeah.
Well, it's the morning.
Better.
It's the morning after. Your operation finished about 12 hours ago, and here you are chatting to us.
Yep.
You've still got the yellowness in your eyes, but your bilirubin's actually much lower than it was before the surgery, and that's the thing that gives you the pigment.
Yes.
That yellowness in your eyes will take a little while to come out because it actually sits in the cells in the eyes. So don't panic about that, but you'll actually notice it starting to fade over the next few days if everything's going well.
Very good.
So I would expect another day or so down here in intensive care for you, and then we'll see when you're ready to get up to the ward.
Okay.
We were talking about when the 2 of you might meet up. It's a bit early to know at the moment. I think if he hadn't had that dizzy episode, I'd be more confident about saying that tomorrow would be on the cards, but I think we'll just wait and see how we go with that.
Yeah, that's fine.
It's not an emergency.
We're not going anywhere, are we?
We'd love you to meet up just because it's nice for you two to sort of get back together again and at least sort of hold hands for a bit, but it's got to be right and safe for both of you.
Yeah.
But we're very happy with both of you, I've got to say.
It's
well
good.
done.
Thank you
Okay.
very much.
Take care. We'll see you tomorrow.
Okay, then, bye.
Max, how you going?
All right.
How you feeling?
Good.
Sanjeev Gupta.
Hi, how are you, Kate?
Hi, Kate. Nice to meet you.
Me too.
So surgery went well. We did pretty much everything that we expected to do. So we had a look at the wound, and firstly it actually looked nice and clean. So that was the first thing. So we could proceed with the next step. We put some plates and screws on the inside there of the big toe. And then the bone felt nice and stable. Had some x-rays that looked good. You had the cut across here, and we actually extended the cut going down here and back down there so we could see things. Everything went great. So the tendon's been repaired, the bone's been repaired, and we've closed the skin up. So hopefully there's no more surgeries. The important thing is now that hopefully we don't get an infection. We're going to keep going with the antibiotics for a little bit, and then following that we'll start getting you walking soon. But everything went actually probably better than we based on what we saw 2 days ago. 2 days ago it wasn't overly optimistic, but everything went well today.
Yeah, that's good.
Thank you so much for
It's a pleasure.
everything.
No, it's a pleasure.
How long will I be in hospital for?
I'm probably home tomorrow.
Home tomorrow?
Yeah, we'll put you on antibiotics for tonight, and if you're comfortable, home tomorrow.
Yeah, sounds good.
Thank you. Thanks,
pleasure.
heaps.
Thanks heaps.
It's a pleasure.
Okay.
You right?
Yeah.
How you feeling?
Oh, man, shower was unreal.
Was it? Be nice
Yeah.
and fresh to see Mum?
Yeah.
Looking forward to it?
Could do a bit of a shave, but, you know.
Don't think she'll mind.
Hey, hon.
Hey, sweetie, how are you?
Good. Yourself?
Yeah?
Put Kelsey under the on the wheel.
Instructions. How are ya?
Good.
I can't bend over.
Yep.
How are you?
Yeah, a lot better today.
Yeah, you seem a lot brighter.
Feel like I'm moving, going ahead today.
Yeah? Had a shower?
Had a shower. Felt so good.
Oh, that's good.
Said you should have had a shave, Dad.
Yeah.
I think you've had enough effort, did you?
Yep. Yeah.
Oh, that's good.
How'd you sleep?
Yeah, not too bad.
How pale you are.
Yeah. Yeah, I'm still puffy, but...
I saw the physio this morning, went for a walk up to the counter
Did ya?
and back, so...
Oh, very good.
Yeah. She told me to do that about 5 times a day.
Yeah?
Yeah. So how you feeling today, hon?
Tired.
Yeah? Yeah, you look a bit tired today.
Hi, guys.
Hi.
G'day, mate. How'd you go this morning?
All right.
Yeah, everything went really well. The angiogram was extremely important. It showed me that you had more disease than I expected. You've got disease through here on the lower belly, but it extends down your leg for another 10, 15 centimetres. And it's causing a blockage of the vessels going to your feet and your legs and also to your thigh. That's why your pressure is so bad in that leg. So I'm going to be taking out and coring that vessel and pulling out the blockage in the middle. That will create a nice hollow tube for blood to get down from the aorta and down your leg. But all in all, we're doing this to get rid of it. The most important thing, like I said yesterday, is no smoking. You've got disease on this side. I've seen it. Okay? That's going to get worse, and it can do exactly what's happened on the other side. The next step now is to get you ready for theatre, and we'll end up operating and finish this thing for you. So today we're going to be doing this old-fashioned procedure, which is really a very good procedure, but we've had to sort of let go by the wayside because of the endovascular revolution of minimally invasive technology with stents and angioplasty. This fella has one major thing going in his favour, and that's his size.